Hello, everyone, and today we are going to continue in our lecture. This first slide. Lecture for the today, we are going to speak about the concept and definition of international health and international agency. What does mean by international health? Additionally, the concept of the international health. Moreover, we are going to explain the role or duties of the some international agency like UNICEF, like WHO, like MSF, many agencies around the world to explain their duties or their role. The objective of this lecture is to understand the concept of international health and also recognize the importance of the global collaboration in the health. Additionally, we are going to learn about the international agency and its role. Yeah, this is the main objective of this lecture. Concern for the what is the international health? The international health is the health of population across the countries, focusing on equity and prevention and global collaboration. That means how we can preserve the health of the population at the different countries, and also how we can let the all people they get the same service. In addition, how we can make the cooperation between the nation, because there is some countries have good resource to manage the disease or to provide a good service in health and other less. By international health, we can do the cooperation. Some countries can support each other by their profession and also by funding, yeah, to let the health to be equal in the different countries. The key feature of the international health, global perspective, and also cross the border collaboration, and also health equity and disease prevention and control. Yeah, the global or international health, that means is the global perspective. That means we can care or we can provide the service for and at the globally at the different countries here. Not some countries are less other. That means it's a global perspective across the boarding and collaboration across the boarding with the different countries. No focus in Sudan. Also, you can focus in Chad and also in the South Sudan, in Libya, and also even in the different country. No take some country and less other. Like example, if there some cholera take place in Chad, it is not means as Sudanese here or the Sudan to less without make any cooperation. It is very important to cooperation can provide the technical person to provide service there and also can help them even by funding if you have enough funding. Yeah. It is the main the cross-border collaboration. Additionally, we are going to explain also health equity. Health equity, that means the health for all. All of people have the right to get the health service. No discrimination between the nation or between ethnic or between people. Yeah. Okay. There's someone tried to enter, but I don't know what is the problem. Health equity, as I mentioned, to be equity, no discrimination between the nation and also people. Yeah, all of people have the equal right. Yeah, equity from the equality. Yeah. No differentiation between the nation and just focus in Europe without Africa or America without Africa. It is not mean like that. Yeah. All of nation and all of people, if all of ethnic, we can support them. No depend on some unless others. Yeah. This is a very important conception to understand about the in global health as a health equity. Lastly, disease prevention and control. Prevention means to protect before before happening for the disease. That means that we can prevent. How you can make the prevention? Let me see all people. Prevent, as I mentioned, before happening for disease, we can make the prevention. Like put it regulation to organize the movement of the people. This is the prevention. And also can clean our hand. This all of this is the one is all of this is call it prevention to before the criteria or precaution were used before the happen of the disease. This is call it prevention. Uh, while the control, that means when the disease is happening or when the disease taken place, how you can make the control. To make the control, that means to stop that spread of that disease or prevalence of that disease. Yeah. Like when there happened outbreak of the cholera, example in Zalinji or in Central Darfur, we can do the control. We can prepare the precaution about the isolation and also can provide the ORS supply, medical supply, and also can activate the message for the clean hand message like that. Yeah, all of this to control. Yeah, to not to let the this cholera to not spread more. Just we can control for like if they are affected by 10 person, we can control this 10 person to not let the cholera to spread more. This is the main the control. After the happening the disease, we can do the control and stop that disease. This is the key feature of the uh, international health. Now let us to go for the very important question. Why international health important? This question, if was to you for the Mr. Abdul Basit or Naima, why international health important? Could you give me some reason? The floor for you.
Yes, because that international health very important. That is help us to uh, uh, help us to identify new diseases and to prevent this to prevent
Okay, okay, good,
health
good.
problems. Yes,
Yeah. One of the international that can let us to identify the disease. And when we are identify that disease, that can help us to prevent or to control that disease. Yeah. Yeah.
yes.
Yes. Thank you, Naima, for this
Yes,
good explanation. Abdul Basit, you need to say something. The floor for you.
yes, teacher, first, thank you. So the spread of a disease around the world can let us to share and participate the information about the specific disease. After that, we can able to know how can we stop it. This is what
Okay.
we can
Thank
share.
you. Thank you. Yeah, to give us the to share the information with the different countries or multiple countries. When we share the information about the cholera or about the Ebola or about COVID-19, that can let the other countries to make good precaution and control that disease. Then we can help us to stop and spread of that disease. Yeah. As you see here in our slide, the pandemic, as we see last time in 2020, COVID-19 taken place world around the world. Yeah. Ebola in 2014. Also, there is a many disease yeah, and influenza also spread globally. Yeah. By international health, we can stop this pandemic disease here. As you see, within the few days, the COVID-19 spread more than many hundreds or many countries around the world with a few days here, more than 10 days here. Ebola, the same in West Africa with a few months here. It's spread in West African countries here, like Guinea and also many countries here, spread here. When we have good precaution or regulation about the international health, that can let us to stop that disease here. Additionally, concern for the environmental threat. As you know, one of the top burning issue around the world is the climate change. By international health, we can fix it, this problem here, because we can do the international cooperation or regulation to organize the bad activities that contribute to affect that contribute to climate change by international regulation or conference here can lead to other can let the countries to commit with that regulation. Yeah, this international is also important why for this year. Additionally, in the impact, economic impact here, also international crisis here, when we see the spread of the COVID-19, we saw that time the many factories, many activities has been stopped. Why? Because to avoid the spread of the COVID-19. When the stop or lockdown, when doing the lockdown among the countries here, that can do the health crisis here, or even can do the economic crisis or disruptor in the trade here, because the restricting of the movement that can affect in the economic here. Yeah, that's why, and also can affect the economic by direct way, like health issue can consume more money or can affect the economic of the countries here. That's why the international is important. One is a pandemic. I mentioned the example like COVID-19, Ebola. Additionally, environmental threat like air pollution and climate change. Lastly, is the economic impact can affect health crisis and also can affect in the economic and also traveling or movement of the people or the goods here. All of these, that's why that's why the international health is important. Now let us to go to historical and evaluation of international health. The early effort in 1851, first international health conference, when the cholera spread in Europe and many people or millions of people have been dead. That's why there is many countries in Europe that decided to do the conference and to stop that cholera, like make the update of the inspection movement of the between the nation, and additionally they update the quarantine law at that time that can also restrict the cholera spread. Yeah. This is the first conference has been taken place in Europe. Yeah. Additionally, in the Pan America in 1902, also the African countries, the American countries, especially the Middle American countries, yeah, they do the organization called the FAO to discuss the collaboration. I think there are like 12 countries. They do the collaboration to stop like plague and also cholera, to stop that disease here. And this organization, they are focusing mainly on the surveillance of the disease. Yeah, how we can do the surveillance. By the surveillance, can let us to stop the spread of that disease. Yeah, this is the early effort did for the international health. In the modern era, after the Second World War in 1948, the establishment of the WHO, and the WHO is focusing how to control or how you can eradicate the disease here. This is the modern era. In 1969, this is the first international health regulation is established by WHO, and they are focusing to put the regulation of the movement and also prevent the law of the quarantine between the countries here that can stop or can restrict it of the spread of the disease here. Additionally, this international health regulation has been updated in 2005, and that regulation even now is functioning well and also is working. Yeah. This is for the modern. Yeah, for the historical, for the international health, as I talk or as I discussed, early modern, first one, 1851, conference for the cholera, 1902, this for the countries, American countries, do the collaboration between them to stop that disease. In the modern era, the establishment of the WHO and 1969 established the first international health regulation, and 2005 has been updating for that international health regulation. Now let us to see the International Health Agency, which work for the international health, for international health. One of there is a many international agency. One of them is the World Health Organization, or its name WHO. This is its logo. This is a logo for the and second agency work in the international health is the Center for Disease Control, DCD. And third one is the UNICEF, also focused mainly for the children. And other one is the Global Fund. The Global Fund also has the role and function for the international law. Last one is the MSF, Doctor Without Border, or Médecins Sans Frontières. This is the MSF. All of the logo I share in my screen. Now let us to start by one by one. The first agency or first organization work in the international health is the WHO, or World Health Organization. The role of the WHO for the global health leadership. Is there any health issue around the world? The WHO is the lead this. There's someone to. Okay. The WHO, when the health issue around the world, the role of the WHO is a leadership, how can achieve and how they can mobilize the resource for that health issue and how it can provide the technical people for that health issue. Additionally, standard, like do the protocol or call it protocol of disease. How you can treat the malaria? There is the protocol we are using here. WHO, who is that person or who is that agency, provides the technical protocol. Protocol for malaria, protocol for the measles, for the different disease here. Provided by WHO. Additionally, if there any health emergency, WHO is the lead and control to do that, to do the response for that emergency. This is the role of the WHO. One of the role of the WHO, leadership role. Secondly, standard for the protocol of the disease, how you can treat the disease. WHO, who is the prepared that protocol. Also, response for the emergency response. WHO is responsible for that. Yeah. This is the role of the WHO. There's someone, he said he need to join, but I couldn't.
Okay, Doctor.
Yes.
At the same time, can we consider this role at the same time it's objective, for example, for WHO?
Like objective of WHO?
Yeah, can we consider like that?
The objective is different from the role. Role let me to set job description. Let me the role, that means their description or their responsibilities. Yeah, the responsible of the WHO role is the same. Concern for the objective. Objective, that means the objective to create WHO. Do you mean that?
Yeah, of course.
Okay, the objective, yeah, we can say there is some, let me to say that there is some, it is let me to say it is the same,
Okay,
but there is some difference here. Objective for the WHO, but objective, that means why WHO is there. Yeah, objective, that why do that. Yeah, and the role it is means like if WHO must do this, is the obligation for him to holding this here. holding global health leadership or standard, or to update the protocol of the disease, or to respond the health emergency. This is his role. If WHO do not do this, another agency or the UN, United Nations, can ask them why you do not do this here. This is the role here. The main achievement of the WHO to eradicate the smallpox. Yeah, this is the main. Like in 1974 or 78, the eradicate taken place. Smallpox has been eradicated. Yeah, this one achievement of the WHO eradicate the smallpox. As you know, the smallpox affect the many people, and many people has been died by smallpox. But the WHO developed the vaccination and also can let this disease to eradicate. Even now, they are working in the polio. Yeah, but it's still going. Yeah. Additionally, another achievement of the WHO is the international health regulation. Yeah, international regulation. That regulation to stop to organize the movement of the people and also its goods. Additionally, to update the law of the quarantine law. Yeah, this is do it by WHO. Lastly, response of the COVID-19 last 2 or 3 years has been response by WHO. This is the main achievement of the WHO. Now let us to see another agency. This is the DCD, Center for Disease Control. The role of the DCD, the main is in the USA, in the some wilaya or some state call it Atlanta. The DCD D or CDC have the main role to disease prevention and global health support, to make the prevention of the disease. Like example, provide the PPEs, perspective or PPEs, personal perspective equipment, like gloves, like mask, like nebulizer, like all of these call it PPEs here. DCD, one of their role, provide this internationally to prevent the disease. Because when we are treated, the people have been affected by Ebola, and we couldn't use the PPEs. That definitely, majority of people will dead, will die. Yeah, that's why the internationally, when we are produce enough PPEs and we can prevent. Yeah. The achievement of the DCD, also his support or the funding the HIV program and Ebola and Zika response. All of this, sometimes DCD funded this program. As you know, the HIV, one of the very dangerous country. And you know, these days has been spread very rapidly in Sudan after the war. Yeah. Today, when I was in the cluster meeting with the Ministry of Health, I realized there is 2 cases of the HIV and also TB or tuberculosis. And last week also there are around 4 cases here. That means the situation is very difficult, especially for now. Yeah, everyone you have to control his behavior, as you know. How you can control this kind of the disease? Yeah, but now it's spread rapidly in Sudan. Yes. Ebola, also achievement of the DCD is the support Ebola. Ebola is taken place 2014 in West African country. Yeah, DCD supported even stop it or control that disease. Zika response also taken place 2018. Yeah, in Brazil also due to some problems there. Also has been responsive. CDC also support those teams there. Additionally, technical assistance. There is a provide the money, internship, and training for the different people around the world by CDC. Now, even African United or United African also is established. There's some body called the DCD for control disease. Yeah. But the main CDC is in USA in Atlanta. Yeah, in Atlanta. Now we can see another agency is UNICEF. Main role of the UNICEF to protect or the child health will be to let the child live and with entertainment or with the good health. Yeah. This is the main role of the UNICEF. Yeah. And you know, UNICEF yearly provide like 1 billion around the world here, provide the money. Achievement of the UNICEF provide the vaccination for the polio and measles. Yeah, provide the vaccination and measles here to stop the spread of this. Additionally, focusing in the water sanitation program here. This is the main achievement. Yes, provide the vaccination around the world. Additionally, provide the wash service. Sometimes chlorination, sometimes provide the latrine, sometimes provide the good water like that. This is the main achievement of the UNICEF. In the picture, you can see the vaccination of this child. Now you can see the Global Fund and MSF. The Global Fund focusing also fighting of the AIDS and TB and also malaria, and also funded more than 100 countries around the world. This is the Global Fund, provides the AIDS. Yeah, as you know, the AIDS is one of the dangerous disease in the West African or in the sub-Saharan African countries here. Spread in the different countries here. Global funding that provides the funding for the AIDS and TB. TB also one of the very dangerous disease because it spread rapidly, especially for those people affected by AIDS. Yeah. Because need someone have low immunization or low immunity. Additionally, malaria. As you know, malaria one of the yearly around 300,000 of people die by malaria. One of the dangerous countries. Yeah. Additionally, another organization is the MSF. MSF, as you know, MSF, Médecins Sans Frontières, is a medical organization provides service from the different countries. And as we see the Ebola and cholera outbreak and different conflict. Even right now, we see the MSF present in the central Darfur area and also in the different area around the world. Yeah, MSF is there. Every time and everywhere, when there are crisis, MSF is there. Yeah, this is the money This is the rules by the money agency which support the international health. All of these countries, all of these agencies working how you can provide the good service here without the board in the different countries here to support the international health. Now you can see the challenges to achieve international health. One of the challenges, emerging disease. There is a everywhere or every day there is a new disease like COVID-19. Before the many years or before the 7 years, there is no COVID-19, but has been re-emerging or emerging. Also Zika, before taking place in Brazil, there is no Zika, but the emerging. Emerging, that means the new disease. When the new disease taking place or emerging, that the effect or is considered the international health because many people not have background about it. As we saw, when the COVID-19 taking place, as the first months here, many agencies, many expertise, they don't know how you can control it here. But after doing some research, after that, they are discover the mode of transmission and also how you can prevent that disease here. Also, Zika the same here. When the emerging disease or new disease is challenges for the international health because is the no idea about it or no information about this. That is the challenges because before the people get him well or because to develop his control or precaution is the spread in the many areas or in spread in the many places here. Secondly, health inequity, rich and poor nation. Some countries have ability to provide the service or to buy the drugs and provide the service, but another nation is difficult to buy. Some people they are suffer from for the basic needs. Yeah, when health inequity also can affect because those people, poor nation, is difficult to stop to provide the service from themselves. And also we know that disease it is not no border. If there some countries have some country affected by some disease, definitely can transfer for the another countries here. That's why the challenges for the international health because some people it is difficult to have the good money to provide the service here. Additionally, climate change. Climate change is a global issue, and many nations and also many countries they are suffer from it here because when the emission of the carbon dioxide definitely can affect the problem in the different area or in different countries here. No specific place here. Yeah. Last point also the political barrier and economical barrier here. The political barrier also can affect because every country has its own regulation and also its own authorities here. Yeah, it is difficult to make to solve all of that problem here. Yeah, that's why this is the challenges of international health, emerging of disease and health inequity, and also climate change, and lastly, political and economical barrier. Now we can let us to see the conclusion. International health means the global collaboration. It is very important to do the collaboration between the countries, yeah, between the poor countries and rich countries. This is very important for the international health. Additionally, agencies like WHO, CDC, UNICEF address the across the border. This agency or organization, which I mentioned, it is the response for the health problem or issue at the different countries. Yeah. Last point, equity and preparedness are critical. Call action. call to action, how you can contribute to global health here. It's very important. I think this is the last slide here. Is there any question? Color for you. If no question, we can stop our session. Thank you, Naima, thank you, Abdul Basit, for your attendance for this session. I will share this video and also I will share the material at the Classero. You can find there. Really, I'm very happy for your attendance. Thank you.
Okay, thank you,
Yes, thank
Doctor, for giving us the opportunity. We do thank you so much, inshallah.
Yes, thank you.
Oh, yeah, thank you. Thank you. Have a good day. Thank you.
Okay, shall meet next time, inshallah.
Yeah, we shall meet. We shall meet. Yeah. Stop recording.